Welcome to the Perfect Dose podcast. We dive into everything you need to know about skincare treatments, wellness tips, and skincare routines so you can look and feel your best. If this sounds like you, make sure you hit subscribe so you can stay up to date on the latest episodes. I'm your host, Dr. Kristen Herzog, board-certified nurse practitioner and injection specialist. My med spa, The Perfect Dose, is located in Scottsdale, Arizona. If you are interested in becoming a patient and seeing me in practice, make sure you head straight to my website. If you're a medical provider and you want to stay up to date on the latest trends, techniques, have access to my protocols, articles, and business tips, make sure you follow me on Patreon at The Perfect Dose. For everyone else, follow me on Instagram and TikTok at The Perfect Dose. Hi everyone, welcome back to this week's episode. Today, I want to talk about 4 hard pills to swallow in aesthetics. And what I mean by that are these are things that people come into my practice all of the time when they are doing Botox fillers and they have these unrealistic expectations. And so I am going to set the record straight. Although they are hard pills to swallow, it is the absolute truth. And if anyone tells you otherwise, they are lying. So let's get into it. The first thing I want to talk about is that the lip has limits. So many people come into my office and they want their lips looking like Angelina Jolie, and they come in with very thin lips, not a lot of body to their lips, and they are wanting these big juicy lips. Or maybe they've had filler before and they think that they want their lips bigger and that they can just be as big as they possibly can with dermal filler. And the truth is that is just not possible. Our lip has limits. It can only be stretched so much. There comes a point where no more filler can be put into the lip without causing migration, without overstretching the tissue, and literally without making you look like a crazy weirdo. So it's important to understand realistic expectations when it comes to aesthetics, and making sure that you know the lips have limits is one of them. So how do you know if your lip has hit its limits? Well, first thing is when you come into any practice, you are going to get a full assessment, and your injector is going to need to tell you what is realistic for you based on your own anatomy. So just because your friend got lip filler and her lips look like this doesn't mean that your lips will look like that after one syringe of filler. Every single lip is so different. We all have different lip shapes. There are M-shaped lips, more full lips, so many different lip shapes out there. We have to take this into account. And the other thing is the quality of your lip tissue. So some people's lip tissue is very loose and some people's lip tissue is very firm. And if your lip tissue is very loose, it's going to take longer for you to get the outcome that you're looking for if you're looking for volume, because we're going to have to fill all those nooks and crannies first. So every single person is different. Not all filler is the same. So for example, if you have smaller lips and looser lip tissue, I need to choose a filler that is very flexible, that's not super structural, or it is going to look and feel unnatural in your lip. And if you have lip tissue that's very full, so let's say you come in and you have firm lip tissue. It's great. It's like medium to firm. You have some structure. You're just looking for a little more oomph. Well, I can pull a more structural lip filler for you. And then your lips are going to be much bigger after one syringe than the person that has looser lip tissue and smaller lips. That's going to need that softer product first, almost as a lip building, right? We have to build your lip. So think of it like the first session is really just setting the framework. We're probably adding some definition, some hydration, but pending your lip shape and size, you may not get a ton of volume after your first session. It may require lots of sessions. Like typically, I would say anywhere from 2 to 3 lip sessions is average for somebody that has really small lips, that is looking to build their lips naturally and making sure that they don't overfill the tissue. So what I recommend is getting 1 syringe of filler. I never add more than 1 syringe of filler at a time for my patients, even if they ask me to, because it is simply too much for the lip to handle. We have to make sure that the lip has natural time to stretch. So 1 syringe, and then I wait 4 to 6 weeks and I add another. So that's typically my cadence. And then once we're like, okay, your lips look amazing, maintenance, it's going to be 1 to 2 times a year, sometimes longer. Some people will hold on to filler longer. So this myth out there that filler just disappears, that's not the case. It may take multiple sessions to get a compounding effect, meaning getting filler layered in a particular area so that it lasts longer, but filler does last. And pending the person, some people may have filler that lasts longer than others. It really just depends. But again, the lip has a limit. So I have literally had patients sit in my chair where I try to put more filler in and I'm like, there's no more filler that's gonna fit in your lip. So hardest pill to swallow is that lips have limits. Everybody is different and we cannot achieve certain looks for every single person that they want. It's all dependent on your anatomy and all dependent on your lip tissue. So one syringe for one person is going to look very different than one syringe for another. And we have limits. I can only fill as much as your anatomy allows. And your anatomy may allow 2 to 3 syringes. Your anatomy may allow 1 syringe, but we can't break anatomy or that's when we have problems. The second thing I want to talk about is bruising. And I cannot tell you how many people come into my office, and you guys, I freaking love you. So if this is you, know that I love you. I have the best patients in the world and I am forever grateful. But you guys come into my office and people do this all the time. And they're like, by the way, I have this event tomorrow. Don't bruise me. What? Hello, look at this diagram. Like, look how many vessels are on your face. There is no way that I could avoid bruising you 100% of the time. I tell my patients, plan to bruise, be happy if you don't. Even if I've been injecting you for 5 years and I've never bruised you, today could be the day. And this has literally happened to me before. I have this patient, I love and adore her. I've been injecting her forever. And she's like, Kristen, oh my God, you're amazing. You never bruise me. And I'm like, girl, it's your anatomy because trust me, I bruise people sometimes. And anyways, she comes in the day before an event and she's like, it's fine. I know I'm not going to bruise. I'm like, but you could. And of course, that one time she bruised. And this is something that we can try to avoid. Obviously, I tell my patients, make sure that you take arnica, make sure you're eating pineapple, avoid caffeine, avoid like fish oils, blood thinners, avoid alcohol. Things like that will minimize bruising and swelling, but it can't always be avoided. So my biggest advice is if you're worried about bruising, you need to make sure you're planning ahead. So plan 2 weeks before any big event. Typically, your bruise is going to go away in like 3 to 5 days, but you never know. Everybody heals differently. Some people bruise, some people don't. And this picture, you guys, can show you exactly why. It is more likely that you will bruise than not bruise before your injections. So make sure you guys are just planning accordingly. We are putting a needle in your face, and that needle can cause you to bruise. Simple as that. It can happen. Sometimes we can minimize it. Sometimes we can avoid it, but it's best to be safe and make sure that you're planning your appointments around any big events. The next pill that I want to talk about that's really hard for people to swallow is facial symmetry. People will come into my office and they're like, Kristen, I have this asymmetry. Can you make me symmetrical? I want to be symmetrical. One side of my face is higher than the other. One side of my face is flatter than the other. I have this chin dimple here. My jaw is longer on this side. You name it. People come in all the time. And the thing is that we can never correct facial symmetry 100%. That is reality. And in fact, if we did try to make you 100% symmetrical, it would look very weird. So let me show you guys this photo. This is a side-by-side of some of the most beautiful people in the world if we made their faces exactly symmetrical. And it looks bizarre. They don't look beautiful anymore. So asymmetries are beautiful. They're natural. Our face is not meant to look exactly the same. So asymmetries are okay. We need to embrace them. So if you come in my office and one brow is higher than the other, I cannot magically make that brow match. I can't make your lower brow as high as your higher brow. I can do my best. And that's the beauty with aesthetics is if you find a really good injector, we can make asymmetries as close to perfect as possible. Like typically when I'm injecting a brow, for example, I will add more Botox in a different place on one side than the other to try to account for asymmetries. Or we can add Botox on someone's eyelid if their eye is smaller on one side than the other and try to bring them as close to symmetry as possible. But 100% symmetry is just not going to happen. So find a good injector that can bring you close to symmetry and make sure that you have these realistic expectations. Your injector needs to be telling you these things. I show my patients, I have them look in the mirror and I'm like, do you see this one brow is higher? Do you see this part of your face looks different? I am going to do my best to make them as symmetrical as possible. I'm going to make sure your face is balanced and harmonized, but I won't always be able to make you perfectly symmetrical. It's just not realistic. And in fact, it would look weird. We don't want perfect symmetry. Asymmetry is natural, normal, and beautiful. Okay, guys, I saved the best for last because this might be the hardest pill for anybody to swallow that gets Botox injections. But it is normal for your lines to come back before 3 months. Okay, it's normal, it's gonna happen. So, this is how Botox works. Botox has a peak effect. So, and when I say Botox, I'm talking about everything. I'm talking about Dysport, Jeuveau, I'm talking about Xeomin, Daxxify, all of them. I just use Botox. I use that word like I use Kleenex. So I'm talking about all of them. So when you are getting injected with Botox, there is this peak effect. When it's injected into the muscle, it starts to take effect within 3 to 7 days. At 14 days, you have its peak effect. That means Botox is kicking in the hardest. So you're gonna feel so freaking frozen. Sometimes your face will like feel too frozen, it'll feel weird. And then slowly that's gonna taper down. So typically you will be happiest with your Botox for about 6 weeks. Yep, you heard that right. 6 weeks. That is when your Botox is gonna look the best. It's gonna feel the best. You're gonna have no lines. It's gonna be amazing. You will be in Botox bliss, is what I like to call it. That's at 6 weeks. Now, what happens after 6 weeks is we start to have this decrease of the effect of Botox. So slowly your wrinkles will start to come back. Typically around 8 to 10 weeks, you're like, oh my gosh, my wrinkles are back. I need to get Botox again. But we don't retreat because you are not back to baseline. So although you have some movement, which is normal and natural, it doesn't mean that your Botox didn't work. It means that its effect is starting to taper down, which is what we want. Nothing in aesthetics is permanent. Unless you go get surgery, there's nothing that's permanent. We cannot make your Botox last forever. So it's important to understand that when Botox has its peak effect, that is when you're gonna love it the most. It is gonna be anywhere from 2 to 6 weeks. So usually for my brides, I tell them all plan 4 to 6 weeks before your wedding. That way you love your Botox, you look perfect. And then we retreat you every 3 to 4 months. Now, some people are unicorn babies and it lasts much longer for them. So if that's you, that's amazing. But it is not true for everyone, and everybody has a different metabolism. So if you work out a lot, you do hot sauna, hot yoga, if you're losing weight, all my Ozempic girlies, you will not have a longevity with Botox that some other people have. And that is normal. That is okay. It doesn't mean your Botox isn't working. It means that it worked normally exactly like it should. It had its peak effect, it started to taper, and then you return to baseline. So this is normal. You are not meant to be frozen for 3 months, okay? You will have lines. They will come back. They will come back slowly. And we want this because we don't want something permanently in our face. We want something that is going to last, give us a really great optimal result. And then we are going to redo that treatment to keep our results lasting longer, to increase longevity, all of those things. So if your Botox isn't lasting as long, there's a couple things that you can do. Number one, you can take a zinc supplement. So I tell all my patients, take a zinc. This is huge because zinc actually is required in your body in order for Botox to work. So taking a zinc can actually make your Botox last longer. The next thing is make sure you are being dosed appropriately. So dose is duration. So if you've been, let's say, getting Botox for 10 years and you've had the same dose, you've been doing like 35 units your whole life, suddenly it's not lasting as long. Well, we can increase your dose. So on-label dosing is 64 units for the upper face. That means 20 units, 20 units, 12 units, 12 units. And this could vary, right? Some people need less, some people need more. So make sure that you are at an optimal dose, and this may need to increase. Our bodies change. We lose collagen, our muscles change. So it is not uncommon for us to need a higher dose at some point in our lives. So make sure that you have a great dose. After that, you have to understand this is just the life of Botox, and you can try other neuromodulators. So for some people, they feel like Dysport lasts longer or Daxxify lasts longer. That's amazing. It may not be for you. I tell my patients usually with Daxxify, they'll get about 4 more weeks than they would with Botox. That's what I've found in my practice. So some people really love that, and we treat them with Daxxify. For others that work out a lot, I love using Dysport. Dysport has a higher amount of active toxin in it, so it does tend to last a little bit longer than Botox, but they are all equal. They're all neuromodulators. They're all based on the same protein. So let's say you are resistant, which is really rare, but Botox doesn't work for you. None of them are going to work for you if you are truly resistant. Most people aren't truly resistant. Most people just need a higher dose, and most people need a come to Jesus moment that's like, okay, our Botox isn't supposed to last 3 months. It's supposed to last 6 to 8 weeks. That's normal. That's okay. It doesn't mean it doesn't work. So these are the hardest pills to swallow in aesthetics. Hopefully, after listening to this, you guys can be assured that this is all normal. We cannot overfill the lips. Our lips have limits. So we have to fill based on your anatomy, and that may look different for every single person. Also, it is normal for your Botox to not last a full 3 months. You're not going to be frozen for 3 months. Your lines will come back around 6 to 8 weeks. Some people get a little bit longer than that, but on average, that is pretty normal. Next, facial symmetry is not always possible. And in fact, we want asymmetries. Asymmetries are beautiful. So make sure you go to an injector that is showing your asymmetries to you before you get injected, because if you didn't notice them before, you definitely are going to notice them after you get Botox or filler because you're staring at your face. So that's super, super important. We can try to make your face as symmetrical as possible. So like I said, there's things we can do. If one brow is higher than the other, I can't make it perfect, but I can try to use a higher amount of Botox on one side to give you more lift than I do on the other side to try to bring you as close to symmetry as possible. And the next thing is bruising will happen. We have so many vessels all over our face, so plan accordingly. Do not get filler the day before an event. Thanks for tuning in to this week's episode. I will see you guys next week.